World Doula Week begins on Friday, and research has really shown doula support can be pretty beneficial. So joining us this morning to explain a bit more about how doulas operate, Megan Tim and Crystal Judah. Ladies, thanks so much for being with us.
Thanks for having us.
Okay, so if people are maybe wondering, what is a doula? Let's just start there. Let's get down to the basics. What is a doula? Tell us about that.
Yeah, so a doula is someone who provides informational, physical, and emotional support to someone while they're pregnant throughout the whole course of their pregnancy, labor and delivery, and that immediate postpartum period.
Megan, why is a doula important? What is their role when it comes to a pregnancy?
Yeah, it's really hard for a birthing person in that moment of a real vulnerability when you're trying to deliver a baby to be able to advocate for yourself. And so that doula can really be there to put you at ease, to help answer some of your questions, to encourage you to ask questions if you don't know exactly what's happening. A doula is really there to be your guide and your friend and your support. And it's important for us in healthcare to have doulas there, because we can see some better birth outcomes, honestly. When a mom is getting what she needs, we can see that baby thrive, honestly, and that mom really thrive too with the support of a doula.
We hear the terms doula, we hear the terms midwife. Can we talk about maybe the difference between the two?
Yep, so the major difference between a doula and a midwife is that doulas don't provide medical support, whereas midwives will deliver a baby.
Okay, and talk to us about community impact here. What have we seen so far when it comes to their roles?
So I think like one of the best things that I see, so we're all happy and looking forward to those positive birth outcomes, but before that baby even gets here, my job as a doula is to empower people to have like an active role in their labor and delivery and their postpartum and their pregnancy experience, just kind of letting them have a voice in their pregnancy.
Megan, what kind of rates are we seeing when it comes to birth outcomes right now? Are they looking favorable? Are they getting better?
Yeah, in Dane and Rock County, we actually have some major inequities happening in our birth outcomes, where our Black babies are dying at a rate of 3 to 4 times higher than that of white infants in our same area. So there's been a lot of energy. Crystal's team, as well as many others in the area, have been coming together to really look at what we can do as a collaborative, from healthcare systems to community partners to doulas, community health workers, coming together to really support that mom in the center of all of this work. And we all take some effort to really lift up that mom, as Crystal was saying. So empowering that mom to get all of her social needs met, to make sure that she has all of her questions answered, and so that we can see those birth inequities go away.
Yeah,
we don't want to see that anymore.
Right. Ladies, are there any other thoughts that you want to share with us? Anything I didn't touch on today that you would like to mention?
I would just say, when we can circle around a mom and a birthing person and ensure that her voice is heard in this process, we're going to see some really great results.
Because really, they are the star of the show.
That's
right?
exactly right. That's right.
Okay, you two, thank you so much for being with us today. We appreciate it.
Thanks for having us.
All right, we're back after the break. Stay with us.